Good evening, everyone. We have started the series of gynic cases. This is 21st case for the awareness of family students. So I'm going to discuss postmenopausal bleeding through a case. So first we need to understand what is menopause. Menopause is a natural biological process in a woman's life when her menstrual period stops, marking the end of woman's reproductive years. The average age is 51, but it can occur anywhere between late 40s and early 60s. During menopause, women undergo certain physical changes like night sweats, vaginal dryness, sleep disturbances, mood swings like anxiety or irritability. Bone density also decreases due to low estrogen level and risk of osteoporosis increased. Cardiovascular risk also increases, and finally, it also leads to the weight gain. So let's begin with the case. A 59-year-old female patient came with the complaints of blood on her night dress, which was bright red in color and as not as heavy as a normal bleeding. There were no clots and pain during the bleeding, and it occurs twice in a similar amounts. Menstrual history. Menstrual history reveals that she had a menopause at the age of 49 years, that is, almost 10 years ago, and at that time she faced symptoms like hot flushes and night sweats during menopause. Sexual history. Patient is sexually active and recently noticed vaginal dryness during intercourse. Next, gynec history shows that she has two children via spontaneous vaginal delivery. That is, patient had a normal delivery. Medical history. She always had a normal cervical smears and the last one was done 7 months ago. She also had a history of laparoscopic sterilization at the age of 34 years. Medication history. Medication history gives information that patient having a hypertension, and for that she takes atenolol and omeprazole for epigastric pain, and she has a no history of hormonal replacement therapy. Physical examination. So, physical examination says that patient is slightly overweight, abdominal examination is normal, vulva and vagina appears thin and atrophic, and the cervix is normal, uterus is small and anteverted, and with no palpable adnexal masses. Let's talk about the investigation, which is very important for the patient's diagnosis. So, in this patient, endometrial biopsy report shows that atrophic endometrium with no evidence of inflammation, hyperplasia, or a malignancy was found. And endometrial ultrasound shows that endometrial layer, which was very less, that is 5 mm, which excludes an endometrial malignancy or a polyp. Hence, in this patient, there were no overgrowth or a hyperplasia found in the endometrium layer. Diagnosis. The patient is diagnosed with the atrophic vaginitis as she had a history of vaginal dryness at a sexual intercourse, and during examination atrophic vulva and vagina noted. Let's discuss more information about this condition. Postmenopausal bleeding refers to any vaginal bleeding that occurs 12 months or more after a woman has experienced her last menstrual period, marking the end of the menopausal transition. Postmenopausal bleeding is considered to be caused by endometrial cancer until proven otherwise. However, only 10% of the women with the menopausal bleeding are diagnosed with the endometrial cancer. Let's me repeat this point, as this is very important point, that only 10% of the women with the menopausal bleeding are diagnosed with the endometrial cancer. Not every woman diagnosed with the endometrial cancer. Let's see the causes of the postmenopausal bleeding in the slide, and also with the sign and symptoms of the postmenopausal bleeding. So very first we see the causes of the postmenopausal bleeding. First one is the endometrial cancer, which was not that much common, that is 10% in the women's. Endometrial or endocervical polyps. Polyps may be cancerous or may not be cancerous, and in that, overgrowth of the tissue was found. Endometrial hyperplasia. In this, overgrowth of the uterine lining also found, that is endometrial polyps or endometrial hyperplasia. Both are very common. And the fourth or fifth one is the atrophic vaginitis. Atrogenic, atrogenic means the bleeding occurs due to the medical equipment or the anticoagulants like therapy. Then infections like fungal infections. Very common is vaginal candidiasis, sometimes bacterial infections, UTI. This all are the causes of the postmenopausal bleeding, out of which atrophic vaginitis were the most prevalent one, and it found 50 to 60% in the patients. Sign and symptoms of these conditions are vaginal bleeding, pelvic pain, or discomfort. Most common is vaginal bleeding and very easy to identify. Let's move towards the diagnosis. Diagnosis, there are four techniques which were done. The four one are pelvic examination, transvaginal ultrasound, endometrial biopsy, and hysteroscopy. All of these techniques are detailed explanation was done in the previous videos, so interested ones can watch that for more information. Now in this patient, endometrial biopsy was done. So in this procedure, a catheter is inserted into the uterus through the vagina to remove the cells from the uterine lining, and then it was sent for the examination. Hysteroscopy can also be done for further examination. Now move towards the general management. That is hormonal replacement therapy, surgical intervention, treatment of underlying conditions. Now we will see the precautions. What type of precautions should taken by the menopausal woman? The precautions are regular checkups, healthy lifestyle, that is full diet, full proper nutrition diet you should include in your daily routine, medical attention, management and intervention. What treatment is given in this patient? So we will discuss the management and intervention. Treatment with a course of topical estrogen, which given daily for 3 weeks, then twice weekly, and for the maintenance an initial period of 2 to 3 months. That is, firstly the estrogen given for 3 weeks and then twice week. That means the dose tapering is required in estrogen therapy. An alternative solution is to give a combined form of systemic hormonal replacement therapy to protect the endometrium. But due to the risk of hormonal replacement therapy, some women refuse to use it. Therefore, advice given about the lubricants, which decrease the discomfort but does not have a reparative value. That means the lubricants are not that much effective as compared to the hormonal replacement therapy. If bleeding reoccurs after treatment or the diagnosis is in doubt, then further investigations with the hysteroscopy and dilation and curettage is needed. So that's it for today. I hope you understood about the postmenopausal bleeding. Thank you for watching. Please watch our previous gynic video also. Thank you.